Hi friends, I'm Himanshu Sharma, welcoming you to yet another informative session. I welcome you all, and today we are going to talk about something which is not very pleasing to eyes or ears, both. That is, we are going to talk about surgeries. Now friends, when we talk about surgery, there are a lot of fears, there are a lot of scare uh, that we all have. It is natural because it is something that's happening on our own body, right? And any surgery, by and large, what we know today, would leave scars. Some could be visible, others may not be visible. They could be covered scars, but every surgery, by and large, will definitely have an impact on our body. So we all know that surgeries leave scars, and why we are more worried about it is that it aesthetically affects us. So given a choice, all of us would not like to go for a surgery. But the unfortunate aspect of it is that it can be inevitable or unavoidable. There are circumstances when we have to undergo a surgery, it does not have another option. And when our doctor says that apparently there's nothing more that I can offer you other than undergoing the surgery, we have to accept it and go on. Well, I have my friend today, Dr. Siddharth Shah. Dr. Siddharth Shah is a head and neck oncosurgeon, also trained in robotic oncosurgery. We welcome you, Dr. Siddharth Shah, to today's session. And the reason why he is here is he told me a few days ago that he is doing Scarless thyroid surgeries. And this is what was my reaction. I was surprised. I was overwhelmed with the fact that, oh, how can somebody operate without leaving a scar behind? I mean, I've not heard of it. Uh, Maybe it could be some magical thing which we are not aware of. So I decided to invite Dr. Siddharth and let's interrogate him on this particular subject. So Dr. Siddharth, I would not waste much time. I would just bombard you with few questions that we have for the day. So I would love to start with anything you would like to say, Dr. Siddharth, before we start. Would you like to introduce yourself?
Thanks, Himanshu, for inviting me for this talk. Yes, it's not a magician. I'm not a magician, but yes, I have a solution for a scarlet surgery. So, as and when, I would not like to waste time. Let us proceed with our session.
Sure, fantastic. So, Dr. Siddharth, the first question your way is, what is a thyroid gland and what are the most common symptoms that somebody would notice knowing that their thyroid gland is either affected or diseased?
Yes, Himanshu, it's a very important and pertinent question. Now, dear friends, we all have hormone producing glands in the body, and that is known as endocrine glands. The most common endocrine glands that are secreting hormones is one is located in the brain, that is pituitary. The rest, another is in the neck, which is known as thyroid. There's another on the kidneys, sitting on the kidneys, they are adrenal glands. They all secrete some kind of chemical substance in the body. And these substances, they are required for our growth, development, and metabolism. So that keeps our body running. Now, thyroid being the most superficial endocrine gland, it's of major concern because anything, a small thing can affecting thyroid is very, very well visible. It's right in the front of the neck, in the lower neck area, anteriorly, in front of the neck. And in the Greek mythology, thyroid means a shield. So it acts as a shield and it protects the underlying vital organ like windpipe and food pipe. And either side are the neck vessels which supply blood to the brain. So it's right in the front of the neck in the most vital area, and it carries its most important work of shielding that area in the neck. And it protects the lower part of the neck. So the thyroid's main function is to regulate the growth, metabolism, and development. The thyroid is under direct control from brain. So the brain has a signal effect on the thyroid, and it's a very well placed feedback mechanism. The brain signals the thyroid gland to form thyroid hormones, what we know as chemicals, the biochemical substances are known as hormones. These hormones in turn regulate our body metabolism, heart rate, or maybe it affects on the heart activity as well as in the growth. Now, when the blood realizes, the brain realizes the hormones are in adequate amount, it signals back to the gland to stop the production. So it's a very well balanced programmed mechanism, and there is no problem with that system. Now, in certain age groups like pre-pubertal group, when there is increased needs of hormones, where there is a requirement of the growth, development, thyroid hormones need to be overproduced. The thyroid has to work hard and produce more and more hormones. Now, in certain belts like iodine deficiency belt, like in India, we have that Himalayan range, which is kind of a low iodine belt. And when the diet is low in iodine, the thyroid gets enlarged, swollen to increase its surface area, so it gets more blood supply, more iodine, which is deficient in the blood, and it can meet to the body's demand, and so it appears as a swollen gland, and that's what we commonly call as goiter. Now, friends, this could be a temporary mechanism, and with the demand subsiding, probably this may come back to its normal shape and size. There's another thing when the thyroid hormones they either gets produced more or less, it's a medical condition. So what we call as hypothyroidism and hyperthyroidism. So the word hypo means the thyroid is not producing its sufficient amount of the thyroid hormones. And that could be because of many reasons. It could be because of the damage to the thyroid gland, because of the environmental factors, maybe because of the autoimmunity, the body self-destroys the gland, or it could be because of the food items which act as goitrogens. Basically, they deplete the thyroid from iodine. So this all can lead to reduction or maybe downfall in the production of the thyroid gland, and that leads to affect the metabolic activity of an individual. So the person will feel lethargy, lazy. They will not feel like to move out of the bed, sleepy all the time. There will be graying of the eyelashes, or maybe you can say premature fall of the eyelashes. They'll be putting on the weight, and there will be a lot of digestive issues as well. Now, contradictory to that is hyperthyroidism. Here, the thyroid hormones keep on producing, even despite the brain realizing and signaling that to stop the production. It becomes autonomous, and it keeps on producing the thyroid hormones, and the resulting thing is the body becomes more active, hyperactive, and it starts kind of tremoring. A person becomes more anxious. Anxiety is very much a problem. The patient gets insomnia, cannot sleep because it's hyperactive mind, becomes irritable, and will also have kind of increased pulse rate. So they will feel palpitation of that. They can hear this heart sounds. So this is hyperthyroidism. So this hypo and hyper, they are all medical conditions, and by and large, they are always almost controlled effectively by the use of the drugs. So if it is hypo, you give external supply of the thyroid hormones, and if it is hyper, you try to reduce the thyroid hormone secretion or convert it into other hormones or other forms so that it doesn't act on the body system. The most important, this part is medically managed, but the things that comes to surgeon is a nodule. A nodule is a small area of the thyroid which gets swollen or enlarged. Now this can be a single nodule, or it is a part of a multinodular area. So there are multiple small nodules, but there is a more dominant one nodule, and that's the area or maybe the time when a surgeon comes in the picture.
Okay, so that was a very simplified explanation of different conditions which thyroid gland can produce, hyperthyroidism, and that is usually managed medically, as Dr. Siddharth mentioned. But if you have any growth, if you have any deficiency, yeah, I think we had a bad connection. Dr. Siddharth, I would like to know, so can you hear me? Is it clear?
Yeah, I can hear
Okay,
you.
so yeah, please, we can start with the laparoscopic thyroid surgeries and their safety perspective.
Sure. So when I spoke about thyroid nodules, so most important fear for somebody is how common that nodule is cancerous. So the thyroid nodule, as we discussed, needs surgery. So dear friends, don't worry. This majority of the times these nodules are benign or non-malignant. So 80 to 90% of these nodules are non-malignant, non-cancerous. Only 10 to 20% nodules are cancerous. Now, a conventional thyroid surgery is putting a scar in front of the neck in the skin crease. That is the God-gifted crease. The skin crease is the area where probably you can see in the picture that the surgeon has used the skin crease to put the cut on the neck and to remove the thyroid gland. But unfortunately, in certain group of the people, maybe the surgeon has done his best job, the most efficiently close the wound. But certain factors, internal factors from the patient side probably gives a bad healed scar. At times it becomes thickened, hypertrophied or dark colored. And that's very really very disappointing and disheartening. So this is a technique where when you can shift this scar to some other place, that's known as shifting of the scar and which becomes non-visible, but there is definitely a scar on the body. So there were
Okay,
techniques developed to prevent this scar in the front of the neck, but they would put this scar somewhere else, and those sites were probably behind the ear, in the axilla, or somewhere in the chest, in the breast region. But they are not devoid of scar. They will have its own healing issues. And so, dear friends, this is the most recent procedure of thyroid surgery, which we definitely can call as scarless surgeries. Here, the friends, the site from where the thyroid gland is approached is in the mouth. So it will be really astonishing and kind of surprising for you how somebody can approach thyroid, which is somewhere down in the neck, and you are trying to fool around and say that you are going to operate from the mouth. No, friend, it's nothing difficult. There are so many technological advances that has come up in this recent years, in the past decade, and this is made enabled to really give this cosmetic surgery or this surgery a cosmetic look. This is a site where in the lower part of the leg, we make a small opening of around 15 millimeters, not more than that. So friends, it's just a 15 millimeter mucosal cut, and mucosa is very richly supplied with blood supply, and it has a very good healing tendency. You often would have got a cut inside your cheek and it heals completely without leaving a scar. That I am sure you would have experienced a teeth bite and a bite often, and you would never notice that there is a scar after it heals. Similarly, what this is a surgically created wound, and it will definitely heal without leaving a scar. And from here, you reach up to this area with the help of instruments like laparoscopic or a robotic surgery. So you create a space, you open up in this area, you go right up to the lower neck, expose the thyroid gland, you create the working space with the help of the instrumentation and under vision. So you are using an optical system, that is the camera, which gives you an excellent visualization, excellent resolution, and a very nice field view because you can go as close to the gland as 1 or 5 millimeters, and that gives you a very clear definition or depth of the anatomy of the structures, and there is no chance that you can miss out any important structure. The thyroid surgeries, because of this laparoscopic approach, has become really a very excellent tool for cosmetic means with the use of this laparoscopic technique.
That was very informative and promising as well. That it's laparoscopic. It's done laparoscopically. There is no visible scar, as you said, which is there. And obviously, I believe the healing is much quicker as compared to the traditional way of surgery.
Absolutely. Himanshu, this patient, they walk out of the hospital within 24 hours. That's really a great thing. Normally, the
Wow.
thyroid patients, when they get a cut in the neck, they are almost around 2 to 3 days in the hospitalization. They have some drain pipes or just drain tubes out of the neck. They have some restrictions in the neck movement because they feel pain. They have difficulty in swallowing because that area is kind of swollen and they kind of feel difficulty in swallowing. But friends, believe me, this procedure or this technique doesn't leave behind any visible stitch mark. It doesn't need to be removed. The stitches that are taken, they are absolutely absorbable. So means within 14 days, if the doctor doesn't remove it, will get dissolved by itself. The patient walks out of the hospital within 24 hours. The patient can eat, can bark, can move around, and also can swim. The patient doesn't need to come back or follow up for the removal of the species. So that's a really advantageous technology and technique that has come up.
So you have done maximum number of these surgeries in the state of Gujarat. So from your experience, I would like to know what has been the average stay of such patients in your case, and when do you call them for a follow-up?
So as I said, Ramantu, they don't stay more than 24 hours post surgery. So
Wow,
if I
that's
have
great.
operated today, tomorrow afternoon they can go back home. They can travel back to their father. We get patients far off from the place from our city, and they travel
Okay,
back to their home within 24 hours of the surgery. So that's a really fast. You can say it's a one-day surgery as such, and
okay.
it's only after a week's time when they would be interested to know what is the biopsy report, and that's why we call them after a week's period, when we would like to see them for the healing as well as, and we would like to discuss with them the histopathology or the biopsy report.
So technically just about a week, that too, to discuss about the biopsy report. That is what is required in terms of
Absolutely,
an
absolutely.
immediate follow-up. How about a long-term follow-up? Because there is no visible scar. They don't really have to do much about taking care of or bandaging the scar. So they don't need to come back after a week. Like from the surgeon's perspective, they are good to go. They don't need a follow-up. They don't need to see you again.
Absolutely. I mean, most of our patients, they discuss the report on our phone, and I mean, we just telephonically discuss if the report is non-cancerous, they may not see us for next 6 months also.
Wow. So this was really encouraging, especially for people like me who will be very scared to have a scar. Any surgery is definitely scary for all of us. But with technologies like this and doctors like Dr. Siddharth Shah with us, there is a lot that we can do together to improve aesthetically as well as reducing your restrictions when you have off the surgery, when you are out of the hospital. So thank you, Dr. Siddharth. It was a fantastic session. For all our friends who've not been able to join us, don't be disheartened. This session is going to be available on all social media handles of Zydus Hospitals. I would request you to visit there and definitely view this. We request you to also give your feedback, your suggestions, and if you have any questions, please feel free to write to us. Dr. Siddharth would be more than happy to respond to you. And I would love to end this session with a big thank you to all of you, with a big thanks to Dr. Siddharth for telling us about this very innovative, new developing technology. Goodbye and be safe. Thank you. Namaste.
Goodbye. Thank you, Himanshu.